With the evolution of healthcare in India, we now need to embrace smart hospitals that have the potential to provide not just brick and mortar buildings, but digital ecosystems that leverage artificial intelligence, Internet of Medical Things, and cloud computing, etc. We have among us eminent personalities from various hospitals today who can tell us more about building these smart hospitals in India. I would like to request and welcome Rahul Datta, Senior Vice President and Group Head, Ankura Hospital. I would request the audience to please give him a big round of applause. Dr. Shuchin Bajaj, Founder, Director, Ujala Cygnus Hospital. Rajnish Khurrana, Director, Sales and Head of Digital Health Solutions, Getinge. Dr. Sachin, Jhawar, Director, APAC Hospital. Dr. Ashutosh Srivastav, Medical Director, Aditya Birla Memorial Hospital. Dr. Deepak Balani, Medical Director, Sagar Hospitals. JP Dwivedi, Chief Information Officer, Rajiv Gandhi Cancer Institute and Research Center. Dr. DK Gupta, Chairman and MD, Felix Hospital, and Manisha Kumar, Regional CEO, SCG Hospital, are on their way. So we'll just begin with the panel and they can join us whenever they are here. Please give a big round of applause to all the panelists here. I would request Rajneesh sir to please come on the stage and moderate this session. Thank you.
We have a very eminent set of panelists to discuss on smart hospitals, because that's, I don't know whether the earlier hospitals were unsmart, but we all have definite parameters about smart hospitals today, and we would like to discuss on some of those parameters, and more importantly discuss going forward how that smartness quotient can be increased. So ultimately it's beneficial for the patients. Again, as every speaker is reiterating from the morning, that's the ultimately all the most critical outcome on which any hospital is measured. So we have quite a few panelists now, and I think a couple of more will be joining in. They are on their way. Let me start with, we have Rahul Datta from Ankura Hospital. And this is one common question I would like to pass to all the panelists. Basically, one, what is your concept of this smart hospital or smart healthcare, and what are those parameters on which you measure these smart hospitals, and how are they benefiting? So, because just making hospitals smart helps no one. How is it really benefiting the patients, according to you?
So, first of all, thank you for this opportunity, APAC News Network, and very good afternoon to the audience. As you mentioned, Mr. Rajneesh, that smart, what we call being smart, today's day probably in today's topic we're discussing being smart is how tech savvy we are.
Just 1 sec, I think Manisha Kumar, she's here. So ma'am can join the panel. We have Manisha Kumar, Regional CEO of HCG Hospital. Yes, continue.
So how tech savvy we are, how efficient we are when it comes to patient experience, when it comes to patient satisfaction, operational efficiencies that some of our colleagues talked about in the previous panels. But to look at as smart hospitals, I would say that we will go back to the fundamentals of giving care, providing services to the patients as a generic, as a holistic manner. So we talk about the 3 A's in healthcare: accessibility, availability, and affordability. And the other principle that we look at is 3 M's: man, money, and material. So end of the day, if we say as a smart hospital is only a smart hospital if you're able to make those more efficient. Are we able to, with technology, able to make our services accessible closer to the patients? Are we able to make it available to a larger audience, to the larger population? And are we able to make it more cost effective? Then definitely it's a smart approach beyond just technology. But here, obviously, we are correlating with technology here. The other aspect is that internally, as part of being efficient, whether it is operations, whether it is clinical outcomes, whether it is patient experience, can we look at giving a better care in terms of being more efficient in terms of using our materials, being cost efficient there? Can we look at using our resources in a better manner? So somebody, Dr. Mamta, talked about OPD automation. If we look at OPD automation, can we make sure that our number of manpowers are not increasing, but at the same time, the experience for the patient becomes more seamless? Can we give them an experience where the time from they have entered the hospital and meeting the doctor is reduced to a major extent? Then it is a smart approach. Can we ensure that we have cost also optimized at the long term? So like Dr. Kaushal mentioned in the previous panel, that cost escalates in IT by 45%. But at the same time, I would say that it's more of a capex in the beginning that we look at, apart from the SaaS model that we have. But long term, if we look at, if we bring in and measure all these efficiencies, it will be more cost effective. So if you're putting all these things together, I would say that then we are in a journey of achieving smarter hospitals. Is smart hospital there today? Yes, they are there today. It has been there in the past as well. But I think with AI, with Internet of Medical Things, with so many other technologies coming into predictive analytics and everything, we are moving there in a fast-paced manner in the last 5+ years or so, I would say. And we are in that direction. So that is, I would say, with triple A and triple M, we are moving in the direction of smart
triple
hospitals.
A and triple M towards smart hospitals. I think we are joined by our other panelist, Dr. D.K. Gupta, Chairman and MD of Felix Hospital. Can we have the chair? You can put it this side. Okay. Okay. So I'll next come to Dr. Shuchin Bajaj. The same question. Definition of smart hospital and what are the challenges one faces in a hospital becoming a smart one?
So the definition of smart hospital, I think, changes from time to time. Smart is a function of both time as well as geography, right? So see, D.K. Gupta sir is looking so smart and handsome in a suit and a tie. He'll always be handsome. But I think on a beach, if we go, then the suit will not be really called smart, right? We won't be very smart if we wear a suit to the beach. So it's all a matter of time and function. We had smart TVs coming out very early. About 10 years ago, we had the first smart TV, right? And people who bought that TV said, we have no use for it. Doesn't really work because there was no content to support that smart TV, right? We did not have OTTs. We did not have any online streaming at that time, which was mainline. We did not have enough content to support that smart TV. Now we cannot do without it, right? There is no TV which is not smart. So I think hospitals who just focus on, say, we have an EMR or we have a technology instrument in place or we are using a robot is not really a smart hospital. It has to be a matter of both geography, as I said, very importantly. So if we are setting up a hospital in a very small town like Sitarganj, if we have a hospital there, so if we put a robot there and a full EMR there and full technology stack there, will we be really smart? Will we be ensuring return on capital to our investors, to our stakeholders? Not really. To be smart means to ensure that we do three things. We save time for both patient and doctor. We save money for both patient and doctor, and we assure highest clinical outcomes for both patient and doctor. If we can do these three things using as much technology as possible, because only technology can help us in achieving these three things without putting in too much money, then we are very smart hospitals. The definition will keep changing from at a time when we just had telemedicine, or when we were just putting the initial technology stack in place, to maybe in the future will be have fully remote doctors. I was talking to sir yesterday, where the robot was operated by a surgeon sitting in Gurgaon at Sir's hospital. So maybe in the future we'll have not just fully remote doctors but fully remote patients as well. We may have portable surgical suites going to the patient's doorstep and the surgery happening at the patient's doorstep with a doctor sitting in the comfort of his house. At that moment, maybe we'll call that a smart solution. Right now, we may call it a futuristic solution. So these things will keep happening. The challenges, of course, are many. First of all, development of these technologies. Second, acceptance of these technologies and these innovations by all the stakeholders. Most importantly, the patients and the doctors. And third, of course, the funding and the will to fund these smart solutions.
Okay, thank you. Thank you. Dr. D.K. Gupta, I'll come to this question, say, as a CMD of a hospital, when you are maintaining an operational workflow of a hospital and trying to improve the, of a smart, within quotes, if I may say, what are the challenges, the main challenges, one or two, if you can highlight, that you are facing?
So if we talk about any business, like any industry, similar in the hospital or healthcare industry, the business has 7 or 8 core functions like marketing, sales, operations, HR, finance, account, R&D, data analytics, and top management. If we talk about the challenges, the hospital is a very complex business. And if we talk about the operations, there are 3 types of operations in the hospital, like non-clinical operations, clinical operations, and paraclinical operations. And one of the most challenging area is the actually operations of the hospital, including clinical, non-clinical, and paraclinical. If we talk about the smart hospital, there are so many things had come now, like EMR, HIS. In HIS, we have all the modules of non-clinical also, paraclinical also, clinical also. And if we integrate these HIS with the AI and robotics, IoT, Internet of Devices, then definitely the operational efficiency of the hospital becomes very good. That is one of the most important challenge is operational efficiency. And we depend on definitely skilled workers. And there are, like, if we talk about the ratio of the hospital, for each bed we require 4 to 5 employees per bed. If we want to reduce dependency on these employees, then definitely we have to enable our hospital by technology, through technology. And technology is HIS, latest HIS, because there are so many HIS. But if something, every module, like starting from storage, HR, account, finance, and like billing, OPD, IPD, queue management, everything. I think there are so many, I think it is revising every year. There are so many new modules are coming. If these all modules are in-house in that HIS and they are adopted well by your users, then the operations become very easy and operational efficiency of hospital becomes very high. And definitely that impact of this operational efficiency comes from the revenue also, EBITDA also, bottom line PAT also. And the most important, the ecosystem that includes patients, doctors, and hospital management, all three become very happy if we adopt all these technologies, I think. So we have to be smart in terms of operations inside the hospital, be it non-clinical, paraclinical, or clinical. Thank you.
Okay, thank you. Thank you. Manisha, Kumar, coming to you next, in terms of the challenges for a smart hospital today, 1 or 2 very briefly, if you can mention.
Yeah, sure. So I think I agree with what most of the panelists said. It's very much need of the hour. And in true sense, a smart hospital would be one that integrates the digital and physical assets in a unified, in a uniform way, that also ties in with the institute's clinical workflows and big business workflows. Now, to do this, most rudimentary, elementary challenge, a lot of healthcare organizations don't have a robust IT infrastructure to begin with. A lot of hospitals have invested in recent times and gotten there, but broadly at a macro level, I see that itself as a very fundamental foundation challenge. Anything else has to be built on top of the infrastructure that we have. Most of the applications, devices are bandwidth intensive, so that is so important and very, very foundation. And I think the second is, again, at a high level, I feel is interoperability. We have a lot of smart solutions today, which are getting more flexible, more scalable. Of course, there's data privacy, data security that has to be kept in mind. We're all getting there, but interoperability of different health data systems so that they are able to talk to each other, share data, synergize across networks, across cities, geographical locations, and network environments. That is the larger challenge problem to be solved at a very macro level.
Okay, thank you. So you have provided the food for thought for the two panels. We have post-lunch session where the technology decision makers from the hospitals, basically integrating the physical and digital assets and the interoperability that you talked about. Thank you. Next, Dr. Sachin Jhawar. Again, the challenges for a smart hospital today to improve.
Hello. Obviously, as Shuchin sir said, efficiency or smartness means less time or less resources, less money, and the same outcome. So there are 3 points that are there in my mind that, we have evaluated a lot of technology, and I come from Rajasthan where apart from, even at places the internet also is an issue. And lot of these technologies which are offered in the market are actually in the beta phase. So, they say you can do it, but once you start using it or do a demo, you're very disappointed. One is we should not be disheartened. We should make an ecosystem in our organizations where we should be happy with, evaluating technologies. You should make a team which becomes enthusiastic about it. And I will tell you, we were evaluating a company which had a QR code for each bed for feedback. So they could put a QR code on the bed and patient. So it was slightly expensive to our liking. And what happened is the team that was evaluating, they created their own QR codes, and now we don't have to pay. So what happens is the team also, it's a very good learning process evaluating technology. And what I say about technology. So 3 things in technology which are very good is the technology as easy as WhatsApp? Is it as reliable as an email? Is it as affordable as a Zoom? So when I say that, go and evaluate technology and something like that, I would probably say that, keep these things in mind. And I think in a country like India, which is so vast, which is so cost conscious, which is so digitally savvy, if we do not use technology, if we do not use digitalization, probably we will actually be losing out. If you look at where India has grown from the IT industry to UPI to other things, it is all on the basis of technology. So I don't think healthcare should lose out shying away from technology.
Okay, thanks. I like that analogy.
Hello.
As easy as Facebook, as reliable as email, and as affordable as room. That's an excellent one. Okay, Dr. Ashutosh Srivastav. Again, the same question, challenges for a smart hospital in today's perspective.
I think in future, every individual will be a smart hospital, because I have read somewhere that smart hospital does not have any wall. And secondly, this computer means online, they cannot make diagnosis. So in what Japan is facing today, they cannot make diagnosis because in future, if one person is complaining of cough with breathlessness, so it fits into multiple criterias. So now there's convolution neural networking which is working on this, and there's another software, MATLabs, I think. So they may going to make the system very easy, but it will be, I think, after 10 years, it will be very easy because जब भी कोई इन्वेंशन होता है लाइक रोबोट, तो एवरीवन वो यूज्ड टू से कि अब रोबोट आए क्या होगा, देन बिकेम it become a routine. Now robotic surgery, I have seen robotic surgery means like for example hiatus hernia. So in hiatus hernia used to have the admission was approximate for 10 days. But now this hiatus, just because of this technology, hiatus hernia is just like a daycare surgery. So changes to ho rahe hain. Let's see what happens.
But though you are saying, I would prefer not whatever Gen AI or other neural networks you are talking about, that machine do my health diagnosis completely. I hope we, at least in our lifetime, don't see that scenario where the complete diagnosis is done by a machine. Maybe. Okay, Dr. Deepak Balani, next, again, from your perspective, challenges for a smart hospital today.
Thank you.
Yeah.
After all the distinguished panelists having spoken, I don't know what much I can contribute. But see, I'd like to highlight one aspect that when we look at healthcare versus hospitals, healthcare is a broad spectrum, all-encompassing kind of a concept which is across the country. When we spoke earlier in the morning of Viksit Bharat, healthcare in general, and then now we are coming down to hospitals. So we are such a diverse country. Someone very few kilometers from here can't afford something, khane ko nahi hai. And at the other end here, we are on Barakhambaro. We want the best of the best of the best. Let's narrow it down to hospitals. These are concepts Dr. DK raised, Dr. Sachin as well as Manisha. Again, there's a huge diversity. There's something called legacy. Somebody running from the 20th century, someone running from first decade, second decade. Now we have third decade running of this 21st century. So obviously, I'm talking of the broad concept really. And this would hit upon, to give you an idea, yes, you have an app for booking an appointment, you have an app for queuing once a patient is in the hospital, and which also integrates, has a doctor seen, not analytics, inpatients, and then Dr. DK spoke of a very, very integrated HIS. And this is really the core of where we are moving in smart hospitals today. We have 20 different apps for 20 different things. Each one has a separate login. Each one has a separate password, which simply means that I am certainly not going to be accessing these apps, and these don't talk to each other. The concept is of one integrated, holistic HIS, which should cover it from A to Z, right from the womb to the outpatient setting to the critical care, OT, everything. So there the thing is about having such a setup. Let us say 15 years back, we are where, US was where we were in terms of this kind of a thing. Obamacare changed all that. There were regulatory kind of changes. There were regulatory pulls, pushes, and checks and balances to ensure that in a very, very short span, maybe 6-8 years, the adoption of HIS moved from single digits to more than 90% plus. I think this is the one key factor that can transform hospitals. It is not any rocket science. It is not very, very smart, but compared to where we are today, this is what I think we need to do. So this HIS needs to be integrating all aspects of services, be it operations, be it pre-hospital, be it post-hospital, within the hospital, to whatever level of complexity. That said, so for that, this needs to be versatile. It needs to be fully functional in all circumstances. Dr. Sachin raised this. Under all circumstances, it needs to be robust. And then it needs to be user friendly. And of course, see, in all this, it needs to be meaningful, cost effective. And the user interface needs to be such that anybody can actually operate it. We have people who have studied in vernacular. Now, I wonder how they have studied the medicine, but they have done it, yes. So these are people who have difficulty in adopting technology. And being this side of the aisle, say, yes, we are number one in this. Doctors very, very refractory to adopting technology because it is not very, very user friendly. So I think these are some of the characteristics that an integrated HIS needs to have, for want of a better terminology.
So basically, looking at an HIS operating like a super application, integrating all the facets of a hospital operation, great. And one important thing that you mentioned, that should be the catalyst for that can be the regulatory mechanism. While healthcare is one of the more regulated sectors, but I'm sure here the regulations can be beneficial in terms of the HIS adoption. Yeah.
Standards for HIS also. That is one
Yes.
thing that we were expecting for so many years, that there are so many HIS available in the market, and like different types of modules, different types of settings, and they are coming new, not HIS, then coming numbers of new softwares for appointment, for queue management, for networking, for marketing, for patient engagement, for review taking. Everything is coming from different set of people, from different startups, but that is not adding value because we are not able to integrate it, we are not able to use it, and if we are integration is challenging also. And also there is something that if you integrate also, but results and MIS reports are not as per our requirement. So I think there should be something standardized for the industry, for the hospital industry, so that at least basic modules should be for everyone, for a tier 2 or tier 3 cities also. Or for advanced hospital, they can have bigger modules or bigger systems. I think that's the most important thing. I think we have taken one step forward through in last meeting of NAV's Digital Health Mission, and I think that's a promising.
Okay,
Thank you.
So standardization of the HIS, yes, that's a critical aspect. I'll come to you, JP Dwivedi. Now, slightly different. You are coming more from an IT background, unlike most of the panelists who are coming from a medical background. So very importantly, for you, the challenges of implementing things which can make a hospital smart. What are the main challenges today?
First of all, thank you for having me here. Speaking on the same topic at the end, it's challenging. So, Goswami Tulsidas ji has written, na, Sab upma kavi rahe juthari, kehi pattaron videha kumari. So all the similes are already taken away by other poets. Now there is nothing left that I can compare beauty of Sita with. But still, I'll try to answer. So, see, the real challenge, literacy level, cost of technology, telecommunication, reach, all these are the challenges at the public level, grassroots level. Although the digital payment system, the way it has been implemented so beautifully in our country, is actually an example that any challenge can be surmounted if we really use technology effectively. So to my mind, the classic definition of smart hospital will be the hospital that aims to improve every touch point of the patient effectively with the use of technology that is safe, that is easy to use, and that is cost effective. That makes a smart hospital. Challenges are so many and multifaceted. I mean, for example, we want to deploy a good CRM. Now, in a cancer setup, it is such a sensitive subject. Patient has come, has taken some treatment, and now patient is not in touch. You cannot safely assume patient is alive, patient is okay, treated, cured, taking treatment elsewhere, or patient is no more. And it is so difficult, 3-4 times you call and family gets irritated. This becomes a sensitive subject. So we need technological help. We need a lot of, social media and all other means to find ways, whether we should continue following up or not. Just an example. Thank you.
Okay, welcome. Now I'll come to you, Rajnish Khurrana. You have heard all the hospitals speaking on different parameters of smart hospitals, and from improving a workflow perspective of a hospital as a solution provider, how can you help the hospitals achieve that? Or what are the challenges that you foresee, and how can you help mitigate those challenges?
Hello. Yeah. Thanks for the question. See, Getinge is one company which offers solutions, end-to-end solutions to improve the workflow in certain areas of the hospital, and that's what we can look at. Of course, there are many avenues for improvement in efficiency in a hospital setup, but I can tell from the point of view what solutions that Getinge as a company offers. So, for example, we have solutions for OR management, the entire OR scheduling system that can be managed through a solution where we do the complete scheduling on the real-time basis using technology, IT technology, and an interface which is quite intuitive and very easy to use. As one of the challenges that I've heard is the technology should be easy to use. That's one of the adoptional challenges that the hospitals face. So this technology enables hospital to schedule from any time, any location, anywhere from the patient. So another aspect is that technology smartness of the hospital is to be able to utilize whatever resources that hospital has, which if we compare with the world levels, we are quite distant. And yet the patients that we deal with is really overwhelming. If you compare the statistics, we have 0.9 doctors per 1,000 and 1.2 paramedical staff versus per 1,000 patients versus a picture of at least 3.5 as per the global standard. So it's extremely imperative, rather it's necessary that we adopt those smart technologies that help manage these challenges. So this is one of the solution that we offer. We call it a Torin management solution. Then we also have a complete end-to-end patient tracking solution that is called Insight. Right from the time the patient is admitted to the time he gets operated upon, time he gets his IPD scheduled, the time he gets the PAC and admitted, let's say for the surgery, and it goes out. Through some technology adoption, we offer the complete patient tracking mechanism. What are the things that are booked for him, and they're displayed all over, and they are available on the mobile devices of the staff and also of the doctors. So that can be, each and every patient can be tracked. Okay, so it's also about not only about the patient outcome, it's also about patient experience. So
Okay.
this solution is also available with us. And then it's also about the connectivity, and smartness is about sharing of the expertise which could be limited to a distant location. So we have connectivity solution in terms of OR integration solution,
Okay.
where voice data can be communicated using a single interface while the surgeon is operating to a distant location, and a doctor at a remote location can share his expertise. So such solutions are available
Okay.
with Getinge.
Thanks. As we have a very big set of panelists, this round will be the last round, but I'll ask each panelist to speak on basically two aspects. One, when you're talking about the future of smart hospital, what makes you most excited, and more importantly, all this Gen AI and other parameters on which we are measuring smartness. how will it improve patient care? So little bit gazing into the future, but more importantly, how do you think it will improve the patient care? I'll start with you.
I think it's really the question of future, as you mentioned. Some of it has started. The question which Mr. Dey has asked revolves more about, I would look at from a clinical outcome perspective. But if you look at non-clinically also, first with clinical perspective, if you look at the biggest excitement or at the same time challenge for us, and some of the challenges are also mentioned, but there are more challenges when it comes to ethical regulations and everything as well. But the exciting thing is, if we can, is the preventive aspect of healthcare. If we can focus where, whether it is wearable devices, whether it is predictive analytics of data, whether it is medical records of patients, then we are coming up to a disease diagnosis, which probably a human one mind is not able to do. Without having those regulatory challenges, if we can achieve that, in the true sense, we'll be able to improve the overall health of a community, not just patients coming to a hospital. And the other aspect would be, as I said, in non-clinical point of view, if we can truly make the patients, like Dr. Shuchin mentioned about time, can we really make the experience of patients with a lesser time as the patient comes in the hospital? Today, with all the technology that we see, we still have challenges when it comes to patients waiting at the hospitals, at OPD, when it comes to patients getting discharged at the end of the day after all the treatment has been given. If we can improve that, the seamless experience that we see, today what we're seeing coming to the airport, where less human interventions are there and we're able to get through directly to check-ins faster. Can we bring in similar experience at OPD, at IPD, at discharge level also? These will be the most true, I would say, important ones where I would like to focus. And I'll leave the others for the other panelists.
Sure, definitely. Thanks. Dr. Shuchin.
The most exciting thing for me with the increasing penetration of technology, I think, is the democratization of healthcare. See, healthcare for now and historically, the balance of power has always been very unfairly in favor of the doctors. The doctors have been sitting in their ivory towers and they feel that we know the best and we will do whatever we want to do. And at that point of time, the patient has very, very little power on what to decide, whether to go for a procedure or not, whether to agree to the particular course of treatment or not. They have no choice but to listen to the doctor. I think with technology coming in, this is getting solved for at a very rapid pace. And now patients have a lot more say in what is needed and what they want to go ahead with, and whether they have the right information, complete information or not. Second, I think obviously the quality of healthcare will improve with both the stakeholders now equally involved. So we are already seeing it. Health is more available, easily available at the click of a button on your phone. It is available. Lifespans are increasing. Life expectancy is increasing at a very rapid pace. I feel very strongly that the first immortal person in the world who will never die has already been born. I feel that. And I am sure we will continue to work on longevity a lot. So technology has a lot of issues. I think a lot of positive ones as well. A lot of excitement personally for me on these patterns.
Okay, thanks. And that's a real revolutionary thing that you mentioned. Dr. Gupta. Yes. I'm following the same sequence. Yeah.
So if we talk about the future of smart hospitals or future of healthcare, I think most of the predictive medicine, preventive medicine and primary healthcare services, they will be confined to the home care services. Nobody will be visiting for these services to hospital. Being a lab services, pharmacy, health checkups, predictive, preventive healthcare, even few secondary services, healthcare services also. Hospital will be meant for the surgical procedures, emergency procedures, and definitely with this artificial intelligence, as you told, machine learning, augmented reality, virtual reality, robotics, intranet of devices, IoTs, I think it will empower clinical team, they like nurses, doctors, paramedical staff, they will be empowered for the quality healthcare services. They will be empowered for result driven services. They will have one of the best clinical results. Like they will have, like I think their future is that the clinical dependency will be on robotics, on AI. Doctors will be just verifying it, just they will be confirming it, and that delivery will be done. Even everything, I think there will be integration of from website to hospital discharge patient. Every connection point of the health or patient journey that I told by one of the panelists, that each connection point will be automated and it will be controlled, it will be tracked, and it will be measured, and then every live decision can be taken at that moment of time. And
So
that is the future, I
you're
think.
advocating or I'll say predicting hospital as a service sort of becoming the trend. Manisha,
Yeah, so at the cost of repeating some of the points, because I so strongly resonate with them, of course, logistical and convenient access, logistical benefit to patients, and also dispelling some of the asymmetry of information. That is so true. But I think to be more specific, I come from oncology space. I think a lot of revolutionary research backed by AI and machine learning. So just to take a few examples, we have AI-enabled radiology imaging systems. Like what Dr. Gupta just mentioned, that it is doctor's job is not rhetorical, but it's just to kind of proofread, validate, and so on. And AI-enabled software auto contours the tumor, and the doctor validates and reports it. Likewise, radiomics, again on predictive diagnostic side, there is a lot of quantitative parameters in the scans which are missed by the naked eye, which by means of computational algorithm, machine learning, can be crystallized, analyzed, and then a lot of very concrete inferences related to say recurrence of cancer, etc., can be drawn. So retrospective research as well as predictive diagnostic measures can be taken. So I think in terms of research, I think you also spoke about, some of the panelists spoke about, we have a bench to bedside, and now it's vice versa, bedside to bench as well. So a lot of insights of doctors being taken back and then worked on by means of these technologies to do further research and further implement it. So I think that's exciting.
so retrospective research and predictive diagnostic. Great. Dr. Sachin,
I think lunchtime, as a lot of people are looking at their phones and everything. So I will just take 1 minute. How many of you are hardcore hospital administrators here? Involved in healthcare, man? One? Rest? They've come for free lunch, sir. So see, I tell you, go back 10, 20, 15 years. Ask your mom or your dad. Is the journey of a patient better 25 years back? I'm not talking about outcome. Or is it better today? What will most of the parents say? पहले अच्छा था, जर्नी जाते थे, डॉक्टर को दिखाते थे, वापस आ जाते थे, अब बढ़िया है. What do you think? Yes, ma'am? पहले जात आउटकम की बात नहीं कर रहा मैम. मैं आप पूछना, अपने पापा से पूछिएगा, मम्मी से, चाचा से. आई थिंक, पार्डन? ओके, सो द थिंग इज दैट जब से पहले क्या था, अब कुछ हॉस्पिटल एडमिनिस्ट्रेशन एंड एवरीथिंग. सो आई विल टेल यू वन एग्जांपल. व्हाट हैज हैपेंड इज most of the management principles have actually come from military. सारे के सारे management principles military से आए हैं. Now you talk about anything management to people. I am a management stroke hospital person. So तीन चीजें बड़ी समझदारी के आएंगी टेक्नोलॉजी की अगर बात होती है ना. पहली बात यह है, सर हमारे पास रिसोर्स नहीं है, अभी कहां से करेंगे टेक्नोलॉजी सर ये. दूसरी बात अगर होगी, देन दे विल से दैट टाइम नहीं है सर. तीसरी बात अगर होगी तो कहते सर एपीआई इंटीग्रेशन नहीं होगा अपने चाहिए उसमें बहुत टाइम लगेगा. अगर ये सब कुछ हो गया तो सर हेपा कंप्लायंट नहीं, अपने डेटा का क्या होगा. नाउ टिल वी कीप ऑन, सो क्या हो गया सर, पहले है ना जब मेरे फादर एक हॉस्पिटल चलाते थे, ऑनेस्टली बता रहा हूं, अगर कोई जान पहचान का आदमी आता था तो हमारे यहाँ अनीता दी को पता होता था कि यार इसको 100 रुपए कम करने हैं। मैं ऑनेस्टली बता रहा हूं, आजकल कई बार ऐसा होता है कि कोई कहता है कि ये मेरे को डिस्काउंट नहीं कर रहा, मैं अपनी जेब में से पैसे निकाल के लेता हूं, भाई ये 500 रुपए ले जा, मेरे बस की बात नहीं है कि तेरे को मैं, क्योंकि मेरे को हर चीज आपने इतनी ज्यादा रेजिमेंटल कर ली है ना कि मतलब एक मोस्ट ऑफ द डिस्काउंट का क्राइटेरिया या तो किसी छोटे हॉस्पिटल में यूनिट हेड के पास होता है, बड़े हॉस्पिटल में फ्रंट ऑफिस इंचार्ज के पास होता है। वी हैव टू, अनलेस एंड अनटिल आप लोग डिसीजन मेकिंग या तो ऑटोमेट करेंगे, डिजिटलाइज करेंगे, या नीचे लोगों को देंगे। कई बार हॉस्पिटल में मेरे पास फोन आता है कि सर एक गद्दा नहीं दे रही है, मतलब एक एक्स्ट्रा, क्योंकि मेरी मदर सोफे पे नहीं सो पा रही, वो कह रही है कि गद्दा चाहिए, वो कह रहे गद्दा नहीं देना। पहले तो यार हम कमरा खुलवा देते आपका नाम लेके, मैंने कहा मेरे को नहीं जानता आपको। सो आई एम जस्ट टेलिंग यू दैट कीप दीज थिंग्स फ्लेक्सिबल. We don't have to be regimental because we are not here in the army. It is not, life and death is not systems. Life and death is patience and that journey. So, once you have that flexibility thing, then only technology will flow. Because technology में हमेशा कुछ ना कुछ गलती होगी. सर आज इंटरनेट काम नहीं करा, आज इस डॉक्टर ने भरा नहीं, आज इसने ये करा. So, I am saying technology is very, very important. बट अगर हम छोटी छोटी चीजों को देख के और टेक्नोलॉजी को करेंगे, प्री मॉर्टम करते रह जाएंगे, टेक्नोलॉजी का पोस्ट मॉर्टम करिए. मैं राजस्थान में रहता हूं, हम यही कहते हैं यार थोड़ी बहुत मट्टी भाई उड़ेगी, सुबह शाम मुंह धो लिया कर. थैंक यू.
Thanks. That's extremely relevant and valid point that you mentioned. Dr. Ashutosh.
After 10 years, I think India will be the biggest center for medical tourism, because the cost will be going to drop down by multiple times. And secondly, दूसरा क्या है कि customization of treatment, that is another thing. The patient will going to help in convincing the doctors about their long treatment plan. And third is medical records. I think that will be individual's responsibility after 10 years.
Okay, thanks. Dr. Deepak.
I'd like to touch on two aspects really. Audible? Yes, I hope. Two aspects I'd like to touch on. Kind of we somehow missed out even with so many of us speaking. One is the core medical technology. The biggest advances have not come from AI or such kind of analytics. It's come from rock bottom basics. For instance, let us say 20 years ago, when you need a prostatectomy, they cut open the abdomen, remove the prostate, it bleeds like mad. You're there for 1 week, you might have to undergo re-exploration. Then they came in with laparoscopic surgery. You don't need to break open that coconut. You just put in a straw and you suck out the nariyal pani. And then this concept of endourology. You just put in a fine scope and do whatever you need to remove the prostate. And then you came with lasers which shave away the prostate from within. No bleeding. That's it. Patient comes in the morning, goes home in the afternoon. No bleeding, no re-exploration, nothing. So see, there is this aspect of medical technique. It's there in every field, not only the operative field. For instance, diagnostics. Ma'am mentioned about radiology, but it's in lab services. We don't see test tubes in the lab anymore. It's all automated. More than 90% it's all very, very, very integrated, even in the most basic of hospitals, so to say. It is an ICU, for instance, monitoring remotely. You have some sensors on the bed, can be kept in every patient room, in every bed, which give you the pulse, the respiratory rate, the blood pressure, and so on. These are all derived values. How reliable? Reasonably reliable. So see, that is the medical technology, so to say, the core rock bottom nuts and bolts medical technology is where is making huge strides. This is in the hospital setup, of course. The other aspect I would like to speak again, many of us mentioned in terms of flow of information. All the stakeholders do not have access to the same kind of information in the same structured format, which would enable us to actually interpret the same thing from each of our own. So this technology is going to be kind of integrating such that everyone has access to that information and can act accordingly in the better interest of the patient to ensure that, let us say, patient care is faster, better, and importantly, safer with all this transparency. Thanks.
Thanks. So better insights. Okay, Dwivedi, your views on the future.
So I completely agree with Deepak ji. Basically, the crux lies in marriage between medical technology and information and communication technology. These two intertwined together will produce the real smart hospitals. I will say just 3 words, to be very practical. AI, BI, and CI are going to make the music. Now, most of you are aware of AI and BI. The CI is a new term that I am giving, and that is to take care of the dearth of doctors. That is clinician imitation. So a robot actually looking into the patient's primary aspects, doing the triage, working out first level, at least resident's job, and then referring to the consultant. That will help, and that is how technology should be used with ingenuity.
Okay. Thanks. That's again another quotable quotes. AI, BI, and CI will make the difference. Great. Rajnish, Khurrana, you have the last word. The future of a smart hospital. Briefly, if you can.
Hello. I think the future of the smart hospital is ability for the hospital to use, the data, whatever data that can be used to make predictive analysis, and whether they are, they're dealing with the vendors who enable them to analyze that data and present it to them. I think so. That is very critical. I must also say that going beyond, I was hearing a lot about, the cost effectiveness and other things, which was one of the main focuses. Sometimes what happens that the emphasis from the hospital is too much on the visible cost, but it is not on the hidden costs that could be there. So one has to be very careful in selecting vendors who are taking care of many other hidden costs which might not be apparent. For example, cost of downtime of the equipment. If the equipment is not maintained on time, whether there are adequate support mechanisms available to make the system adoption or technology adoption faster or not. So those things also need to be looked into while selecting the vendors. So careful selection of vendors, data security and other aspects are very critical. So whether, is it just the fly-by-night operator, whether they have those systems available, whether there are global standards of HIPAA compliance and other compliance that are being followed by vendors or not, those things are very critical. So I must, caution that the vendor has to have an experience, expertise, and proven track record before selection. So everything is not cost. And also the cost of the equipment should be looked at from the life cycle point of view, not from the initial cost. And yes, companies like Getinge, they do make modular solutions as well. Everything is not thrown upon just immediately. It can be scaled up as per the need. Various aspects can be looked into. There are subscription-based model, pay-per-use model. So please be careful in choosing the vendors and have a holistic information about, what kind of business model they can propose. Okay. So it should not be just the initial cost. Sorry.
Okay. So the CapEx plus OpEx, both. Thanks. So before we conclude, I would request Shangomitra Mohanty for all our panelists. We will start with Dr. DK Gupta. Rahul Datta. Bajaj. Manisha Kumar. Sachin, Jhawar. Dr. Ashutosh Srivastav. Dr. Deepak Balani. Dwivedi. Rajnish, Khurrana. I will request all of you to join for a group photo.